So today our topic is study of abnormal constituent of urine. So you have already completed the normal constituent and the reducing sugar with Benedict test. In introduction, the glomeruli of kidneys are not permeable to substances with molecular weight 70 kilodalton. Hence, the plasma proteins of molecular weight more than 70 kilodalton are absent in urine. In normal urine, the trace of protein which is less than 250 milligram per day is found. The amount is so less that it escapes detection by any of the simple tests. In renal disease or in other diseases affecting renal functions, excretion of protein in urine is increased either as a result of the changes in the glomeruli, allowing increased passage of protein like glomerular proteinuria, or if impaired reabsorption of the proteins into tubules like tubular proteinuria. Abnormally high concentration of protein in urine is associated with lesions of the bladder, prostate or urethra. Test for proteins the protein can be detected in the urine by any of the following tests. Number 1 is heat coagulation test, second is sulfosalicylic acid test, Heller's test, precipitation of protein by alcohol and acetone, and fifth is salting out. So the heat coagulation test, this is the main test we are doing in lab for your exam and practical purpose also. So the principle of the heat coagulation test is when a protein is heated, its physical, chemical and biological properties are changed due to the breaking up of certain bond and the resultant change in the conformation of its molecules. This process is known as denaturation. However, when the coagulable proteins are heated at their isoelectric pH, a series of changes occur involving dissociation of the protein subunits, in uncoiling of the polypeptide chains and mating together of the uncoiled polypeptide chain, which is coagulation. While a denatured protein may be restored to its original structure and function by certain manipulations, coagulation is an irreversible process. So what is the procedure? In our lab, we will take a test tube, fill up to 2/3 of the test tube with urine sample, hold the tube and hit the upper 1/3 of the test tube and lower 2/3 will act as a control. Then here is written as add 2 to 3 drops of 2% acetic acid and boil it again. What will be the absorption? So white coagulation appears on the heated portion of the sample urine. Then after heating of the sample, then there will be appearance of the white turbidity on the upper 1/3 portion of the sample. So this can be for any of the, if it is presence of the phosphate also, in presence of the protein also. Then how can you differentiate in between these two? Then we will add 2% acetic acid on it and boil it again. If the turbidity disappears, this is because of the phosphate, and if this is not dissolved, the turbidity will not be dissolved in presence of protein. So what will be our inference? If the turbidity remain the same, the inference will be the protein is present in the urine. Then heat coagulation is the most definitive test for the urinary protein because albumin is heat coagulable. And what will be the interpretation of the observation? If the turbidity is mildly visible, this is mild or only the plus, or if the turbidity is the moderate, this is the 2+ grade, or the turbidity is heavy turbidity, this is 2+ or more than 2. And another is Elbastic's for detection of albumin. The test is based on principle that protein alter the color of certain acid-base indicators such as tetrabromophenols blue. When the dye is buffered at pH 3, it is yellow. Protein changes this color to green to blue depending upon its concentration. Comparison of developed color with color chart helps in grading the concentration of protein from traces to +4, which is 1 to 2 to more than 500 milligram per deciliter. And second is sulfosalicylic acid test. So what is the procedure? For the sulfosalicylic acid test, we will take 3 ml of urine in a test tube and add 5 to 10 drops. Like in standard, we will add 10 drops of sulfosalicylic acid. And then principle of the test is albumin is denatured by sulfosalicylic acid due to coagulation. then observation will be a white turbidity appears. So the protein is present in the urine if the white turbidity appears after the test. So here are the gradings of the turbidity. If there is no turbidity appears, this is negative. If there is definite turbidity appears, this is 1 plus, and if the heavy turbidity but no flocculation occurs, this is 2 plus. If the heavy turbidity with light flocculation, this is 3 plus, and heavy turbidity with heavy flocculation is 4 plus. And third is Heller's nitric test. Second one also we'll do in our lab. In Heller's nitric test, the principle is nitric acid causes precipitation of proteins, and the procedure is add carefully about 3 ml of urine by the wall of the test tube containing 3 ml of concentrated nitric acid. And observation is a white ring appears at the junction of the liquids. Like you saw in the picture, there is a ring in between the two portion of the liquid. So the inference will be the protein is present in the urine. Then the fourth and fifth is the method of disruption of the shell of hydration. The shell of hydration may be disrupted by the following: precipitation of protein by the alcohol and acetone, and fifth is salting out. Precipitation of protein in alcohol or acetone test is how to do: to add 3 ml of urine in a test tube, add 4 drops of alcohol or acetone and shake it vigorously. White precipitation appears if protein is present in urine. And fifth one is salting out. For it, most preferred salt used is ammonium sulfate. When excess of ammonium sulfate is dissolved in urine in an attempt to solubilize itself, it drags the shell of hydration from the proteins, and hence proteins are precipitated. So this fourth and fifth one only for your theoretical knowledge. Like examiner can ask you in Viva also, but no need to do this test. And here is albumin and globulin ratio. The albumin globulin ratio, normal serum level of albumin in healthy adult is 3.5 to 5.5 gram per deciliter, and that of globulin is 2 to 3.5 gram per deciliter. The normal albumin globulin ratio is 1.5 to 2.5. Reversal of albumin globulin ratio denotes either the low level of albumin or high level of globulin. Low level of albumin in the plasma may be because of reduced intake of protein in diet, which is protein energy malnutrition, reduced synthesis of albumin in the liver due to liver cirrhosis, or increased loss of albumin in the urine in nephrotic syndrome. High level of globulin may be because of overproduction of globulin as seen in case of multiple myeloma. So here is our first clinical case. A 5-year-old female child is brought by mother with history of swelling all over the body for the last 1 week. The swelling started on face, especially around the eyes on getting up in the morning, and slowly it was noticed involving the abdomen, upper and lower limb. There is no history of fever, rash or sore throat. So on examination, the edema was pitting type. Blood and urine investigations showed the followed result: total protein 5.6 gram per deciliter, serum albumin 2.3 gram per deciliter, serum globulin 3.3 gram per deciliter, total cholesterol 258 milligram per deciliter, and 24-hour urinary protein is 3.5 gram per deciliter. So in previous slide we have seen that what is the normal ratio of albumin, the normal range of albumin 3.5 to 5.5, and globulin 2 to 3.5. So see here the albumin is altered, right? Albumin is low, 2.3. And so this is the case of nephrotic syndrome, where proteinuria can be seen, the protein presence in urine in nephrotic syndrome. So hypoalbuminemia, the decreased range of albumin. So in nephrotic syndrome, the albumin globulin ratio is altered, and the 24-hour urinary protein is 3.5 gram per deciliter. This is the main characteristic of the nephrotic syndrome. In nephrotic syndrome, we can see proteinuria, hypoalbuminemia, hypercholesterolemia, and the urinary excretion in 24 hours is 3.5 gram per deciliter. The similar kind of disease is nephritic syndrome. Another disease, nephrotic and the nephritic. Both are disease of glomeruli, but the pathology of the both disease is different. The glomeruli in nephrotic syndrome, glomeruli fail to filter the serum albumin properly. So we get the protein in urine, the albumin. In nephrotic syndrome, the glomeruli fail to filter the RBCs, red blood cells properly. So in nephritic syndrome, we saw that the cola color urine, the red color cola color urine. So by seeing the sample only, we can say like this is nephritic syndrome and the symptoms are like same. And if in nephritic syndrome, 24-hour urinary protein will be 1 to 2. And this is 3.5, more than nephritic syndrome. And the clinical case 2. Yes, 65-year-old male presents to orthopedic OPD with complaint of generalized bone pain for past 2 years. Who is talking? He is otherwise well with no significant past medical history. Followed are the results of various laboratory investigations. Hemoglobin 9.7 gram per deciliter, urea 47 milligram per deciliter, creatinine 1.1 milligram per deciliter, serum calcium level 10.2 milligram per deciliter, serum ALP is 140 international unit per liter. Peripheral smear shows normocytic normochromic anemia. Serum ferritin is normal. Vitamin B12 and folic acid is normal. Serum protein electrophoresis is performed that demonstrates a M band in gamma region. Skull X-ray reveals multiple lytic lesions. Urine investigation shows presence of Benz-Jones protein, and bone marrow biopsy shows 30% involvement of abnormal appearing plasma cells. So your purpose of this case is the presence of this Benz-Jones proteins. Okay, this Benz-Jones proteins, the classical case of multiple myeloma. Are you feeling sleepy? Okay. Drink some water, okay? If you are sleepy. The similar case, the finding all will be same. But only the serum ALP, the alkaline phosphatase, this 140 will be the range of 1000 also. Thus all symptoms are same. Other findings also same. This can be in Paget disease. Okay. So for your purposes, the only Benz-Jones protein. So Benz-Jones protein in multiple myeloma. This is the definitive test for multiple myeloma, the presence of Benz-Jones protein in urine. And the sensitive test for the multiple myeloma is the demonstration of the M-band protein, which is M-band in the gamma region, which is by M-band electrophoresis. So test for the Benz-Jones proteins. So what is the Benz-Jones proteins? The Benz-Jones proteins is like the light chain immunoglobulin, which molecular weight is like 16,000 to 18,000. This is the protein is produced by the plasma cells, like white blood cells. And the principle of there are two tests, flocculation test and the Osgood-Haskins test for the presence of Benz-Jones proteins. The principle of the flocculation test is Benz-Jones proteins are light chains of immunoglobulins which are precipitated at low temperature. So what is the procedure? Heat about 5 ml of acidic urine. If alkaline, acidify with 2% acidic acid. In a test tube, very gently note down the temperature frequently. In presence of Benz-Jones proteins, precipitate occurs at 40 to 60 degrees Celsius. On boiling, the precipitate disappears. If coagulable protein are also present, filter the above while hot and allow the filtrate to cool. The Benz-Jones proteins is precipitate on cooling. And another test is Osgood-Haskins test. Add 1 ml of 5% acidic acid and 3 ml of saturated solution of NaCl to urine in a test tube. In presence of Benz-Jones proteins, a white precipitate is formed which on boiling disappears. So Here we completed the part of the protein presence in the urine.